Kia ora. My name is Maggie Toko. I'm the CEO of the Victorian Mental Illness Awareness Council. We are the peak consumer body in Victoria. I'm also from Ngāti Whātua and Ngāpuhi tribes in Aotearoa. But I've been here for many years. So I'm at the Equally Well Forum symposium, and I actually contributed to a talk that was done by Anna Love, the Chief Mental Health Nurse, around the framework of the Equally Well framework. What I said was that for the first time ever, VMIAC, which is the abbreviation of our name, VMIAC are often asked to comment on different papers and consultations, but not often are we asked to contribute substantially to a framework, which we were on this occasion. And what I want to say is that having the framework is a great start, but the government needs to put money in behind it to support the implementation of what the framework is about. And so some of those issues that affect consumers still are the over-medication of psychiatric drugs, I don't know if it's the unwillingness, but the lack of consultation around the side effects of psychiatric drugs and the physical health needs that are created because of them. And I'll use myself as an example. So when I started taking psychiatric medications, I was 25 kilos lighter. I didn't have diabetes, type 2 diabetes. I didn't have chronic illnesses, and all those things have come on board since taking medications. With Equally Well, we talk about physical health in terms of doing exercise, diet, those types of things, but it's really, really hard. And it's really hard to concentrate on losing weight when you are taking medications that make you eat. It's very hard to lose weight when you take medications that slow down your metabolism and slow you down so that you are unable to be motivated to do anything. So all those things should be taken into consideration. Now, there is a lot of talk around smoking cessation, and while I will agree that smoking is one of the biggest issues that affects our community, it's not the be-all and end-all. We should work towards stopping smoking, actually, because it's so dangerous to our to the community at large. But the fact is, if you have a diagnosed mental illness, you will be taking medication, and that is an ongoing thing. So ideally, what do we do about that? So that's a bugbear with me. It is.
When it comes to the framework, Maggie, you talked about how you were consulted. VMIAC and the care organisation Tandem actually have forwards in the framework that's been developed by the Victorian government. And you said that was very unusual. Also, the fact that they didn't try and change a word that you put in.
That's right.
But did you feel that you helped shape the framework as a result?
I feel that consumers were included in shaping the framework. And we didn't hold back. We said exactly what we wanted to say, and I'm very happy with that.
That's great, and that's unusual, isn't it?
Well, it is unusual. It's unusual because often consumers, we as a consumer peak, can be a bit contentious in our thought processes, and perhaps that's why we don't get asked. So the fact that we got asked and nothing was changed, and we were able to say what we wanted to say, is a bonus to Anna Love and her team. So, and to Neil Coventry, the chief psychiatrist.
And one of the other things that has come up today was from the New Zealand presenters, and Caro Swanson was talking about how, and New Zealand's ahead of the game a bit on Equally Well, but she said how she was very suspicious of it when it first happened. It was one more layer of scrutiny for people with mental health issues. Did you feel the same way, and has it changed for you?
I think it's in the process of changing. From my perspective, it's in the process of changing. If the funds are put behind it, to have not more of the same, but to actually have conversations with consumer networks and carer networks, but around best practice in those situations, I think it will be leaps and bounds ahead, and probably equal with Aotearoa. But certainly it is another level of scrutiny, and it's an interesting one. I talked, in my talk, I talked briefly about having had 2 bouts of uterine cancer, and what was really interesting for me during that process, and I'm in remission at the moment, is that everybody coordinated themselves really well. So I had 3 oncologists, a chemo oncologist, a radiation oncologist, and a gynae oncologist. And they actually contacted my psychiatrist and said, "You've got to get with the program, mate, because we can support on this level, this level, and this level, but she actually needs other support as well, and that's what you're there for." So they made him actually stand up and be counted.
And what did that mean? What did it mean he had to do?
Well, quite interesting at the time. So one of the things that he did was he made himself available for me. But what he actually did was he listened to me. So I was a very forceful patient, as were my posse, as I call them, my supporting friends and family. But I actually said to him, I went to one of the sessions with him and said to him, "Now you need to sit down, you need to shut up, and you need to listen to me." And I'm not talking about mental health, I'm talking about the grief of the fact that I might die. Now if you can't help me with that, tell me. But if you can, I think listening will be the best thing. I don't need a resolution, I don't need your comments, I just need somebody who will listen. Can you do that? And he shut up and said, good.
And that, I presume, is at the core of what consumers want out of Equally Well strategies, is that it's actually clinical change, cultural change, not that it's another focus on that consumers have to get out there and change what they do.
That's right. It's not about us rewriting our story. We have a story. We have recovery. We have the ability to achieve what we want to achieve. But clinicians need not get in the way and putting their diagnosis, their preconceptions about our mental health doesn't help. It just stymies our ability to recover.
Thank you very much, Maggie.
No worries.